Hi, Eileen Veilleux The Fam here. Welcome to another installment in our mini mental health series. And in this installment, we are going to be going over the diagnosis and treatment of attention deficit hyperactivity disorder, otherwise known as ADHD. Now, before we begin, let me remind you to watch the full video because in the video there's going to be 3 key words. When I get to the keyword, I will say keyword, then what the keyword is. At the end of the video, in the comment section, along with the genuine comment about the video, put in the 3 keywords that you hear to be eligible for my 2,000 subscriber free merch giveaway. So let's get started. How do doctors go about and diagnose ADHD? Well, in general, a child shouldn't receive a diagnosis of ADHD unless the core symptoms of ADHD start in early life. Keywords before age 12 and create significant problems at home and at school on an ongoing basis. There's no specific test for ADHD, but making a diagnosis will likely include a medical exam to help rule out any other possible causes of the symptoms. Information gathering, such as any current medical issues, personal and family medical history, and school records. Interviews and questionnaires for family members, your child's teachers, or other people who know your child, such as caregivers, babysitters, and coaches. Excuse me. ADHD criteria from the Diagnostic and Statistical Manual of Mental Disorders, otherwise known as DSM-5, published by the American Psychiatric Association, and the ADHD rating scales to help collect and evaluate information about your child. So how do you go about diagnosing ADHD in young children? Although signs of ADHD can sometimes appear in preschoolers or even younger children, diagnosing the disorder in very young children is difficult. That's because developmental problems such as language delays can be mistaken for ADHD. So children preschool age or younger suspected of having ADHD are more likely to need evaluation by a specialist, such as a psychologist, a psychiatrist, speech pathologist, or developmental pediatrician. Now, there are other conditions that do resemble ADHD. A number of the medical conditions or their treatments may cause signs and symptoms similar to those of ADHD, and some of them are learning or language problems, mood disorders such as depression or anxiety, seizure disorders, vision or hearing problems, autism spectrum disorder, medical problems or medications that affect thinking or behavior, sleep disorders, and brain injury. So, knowing all this, how is ADHD treated? Well, standard treatments for ADHD in children include medications, keyword, behavior therapy, counseling, and education services. These treatments can relieve many of the symptoms of ADHD, but they don't cure it. It may take some time to determine what works best for your child. So what are some of the medications that they use? Well, one of them is what they call a stimulant medication, which is like psychostimulants are the most commonly prescribed medications for ADHD. Stimulants appear to boost imbalanced levels of brain chemicals called neurotransmitters. These medications help improve the signs and symptoms of inattention and hyperactivity, sometimes effectively in a short period of time. Examples of this will include amphetamines. These include dexedrine, Adderall XR, midasis, and Bionase. Another one is metha. I have a hard time with this word, so please excuse me while I try to pronounce it. Methylphenidates, which include Concerta, Ritalin, and others, and Fossilin. Stimulant drugs are available in short-acting and long-acting forms. A long-acting patch of Daytrana is available that can be worn on the hip. The right dose varies from child to child, so it may take some time to find the correct dose, and the dose may need to be adjusted if significant side effects occur as your child matures. Make sure you ask your doctor about any and all possible side effects of the stimulant. So, is there any health risk with stimulant medications? Well, some research indicates that using ADHD stimulant medications with certain heart problems may be a concern, and the risk of certain psychiatric symptoms may be increased when using stimulant medications. Some, as we just mentioned, heart problems. Stimulant medication may cause an increased blood pressure or heart rate, but the increased risk of serious adverse effects or sudden death is still unproved. However, the doctor should evaluate your child for any heart condition or family history of heart disease before prescribing a stimulant medication and monitor your child during stimulant use. That's why they have the questionnaires, because a lot of the medications for different things do have side effects. So if there's any health issues in the family, within the mom, the dad, aunts, uncles, grandparents, doctors need to know this, and you need to be there and be well informed and be involved with your child's care. Psychiatric problems. Stimulant medications may rarely increase the risk of agitation or psychotic or manic symptoms with stimulant medication use. Contact a doctor immediately if your child has sudden, new, or worsening behavior or sees or fears things that aren't real while taking stimulant medication. Now, are there any other medications that they can use besides the stimulant medication? Well, other medications that may be effective in treating ADHD include Strattera, keyword antidepressants such as bupropion, Intuniv, Catapris, and Catve. Autoixma and antidepressants work slower, though, than stimulants do. It may take several weeks before they take full effect. These may be good options if your child can't take stimulants because of health problems or stimulants cause severe side effects. Is there any suicide risk with ADHD? Although it remains unproved, concerns have been raised that there may be slightly increased risk of suicidal thinking in children and teenagers taking non-stimulant ADHD medication or antidepressants. Contact your child's doctor if you notice any signs of suicidal thinking or other signs of depression. And that is a very important point, because a lot of mental disorders do have depression and anxiety with it. And a lot of times there is signs when a child or a person, it doesn't have to be a child, it could be an adult, that gets so severely depressed. They withdraw, They sleep. They don't interact with anybody. They have a loss of appetite. Watch for these warning signs. Excuse me. So how can you give medication safely with all this information? Well, it's very important to make sure your child takes the right amount of the prescribed medication. So parents may be concerned about stimulants and the risk of abuse and addiction. Stimulant medications are considered safe when your child takes the medication as prescribed by the doctor. Your child should see the doctor regularly to determine if the medication needs to be adjusted. On the other hand, though, there is concern that other people might misuse or abuse stimulant medication prescribed for children and teenagers with ADHD. So to keep your child's medication safe and to make sure your child is getting the right dose at the right time. I know what they're talking about with that because my granddaughter is autistic and her mom had a relative take care of her and be a temporary guardian for about a year, I think it was, due to circumstances where she couldn't at that time. And the relative didn't care about my granddaughter. Unfortunately, it was a relative on my daughter's ex-husband's side. But she didn't care about my granddaughter or anything. She just wanted the money from my granddaughter, and she took her to different doctors. And instead of her taking her regular autism medication, she was overdosing her on medication for the ADHD, where my granddaughter was getting very addicted from it. And when she came off of it, she had real angry outbursts. She's better now, and she's not taking that medication. She's back on her regular medication with her mom, which is great. But yes, it does do a number to the child, and if it's not in the correct dose. So make sure if you have a child that has ADHD, that you make sure that they take the correct dose. Because nowadays, there's so much out there that we have to fight against as it is with kids. A lot of times kids don't like medication. So they'll either not take it if you rely on them to do it, or they could overdose, or, sell it, and horrible things like that. So the safest way, if you have a child, especially like a teenager, that's on medication for the ADHD, is give them their individual doses yourself. Do not leave it to them to do it, because things can happen. Now I want to talk about the behavior therapy for ADHD, and let you know what's going on with that. Children with ADHD often benefit from behavior therapy, social skill trainings, parent skills training, and counseling may be provided by a psychiatrist, psychologist, social worker, or other mental health professional. Some children with ADHD may also have other conditions, such as anxiety disorder and depression, which is what I just said. In these cases, counseling may help both ADHD and the coexisting problem. Examples of the therapy include behavior therapy, which teaches, excuse me, where the teachers and parents can learn behavior changing strategies, such as token reward symptoms and timeout for dealing with situations. Social skills training. This can help children learn appropriate social behaviors. Parental skills training. This can help parents develop ways to understand and guide their child's behavior. Psychotherapy. This allows other children with ADHD to talk about issues that bother them, explore negative behavior patterns, and learn ways to deal with their symptoms. And family therapy. Family therapy can help parents and siblings deal with the stress of living with someone who has ADHD. It's important with any type of medical condition, whether it's a mental illness or a physical illness, to make sure that the whole family's involved because it can be stressful on everybody. Don't just have it where it's you and your husband or wife and the child that has the physical or mental illness. Get the whole family involved. Um, you can even go as far as getting some friends involved by letting them know how to treat somebody with a mental illness or a physical illness. Anybody that's associated with the child, you should be involved with what's going on. The best results occur when a team approach is used, with teachers, parents, therapists, and physicians working all together. Educate yourself about ADHD and available services, and work with your child's teachers and refer them to reliable sources of information to support the efforts in the classroom, which is one of the things I just mentioned. There is a new medical device that the U.S. Food and Drug Administration approved to treat children with ADHD who are 7 to 12 years old and are not taking any ADHD prescription medicine. Only available by prescription, though. It's called the Monarch External Trigeminal Nerve Stimulation, or ETNS system. It's about the size of a cell phone, and the ETNS device can be used at home under parental supervision only. When the child is sleeping, the device generates low-level electrical stimulation which moves through the wire to a small patch placed on the child's forehead, sending signals to areas of the brain related to attention, emotion, and behavior. If a ETNS is being considered, it's important to discuss the precautions, expectations, and any possible side effects that come along with it. Make sure you get complete information and instructions from your healthcare professional on it, because that's important. And that will be it for attention deficit hyperactivity disorder, otherwise known as ADHD. I hope this mini-series has helped you out. If you would like me to cover something out, please feel free to put something in the comments or send me a DM in Twitter or on Instagram, and I will be glad to check into it. And if it's something I haven't covered yet, I will be glad to research it and cover it for you and help you out the best I can. But before I go, let me just remind you of what this channel is about and what I am about. I'm about teaching education, helping people to see with their heart instead of their eyes, because the eyes can be deceiving. Somebody could be beautiful on the outside but be awful ugly on the inside, which overweighs all that beauty. Or it could be vice versa. They may not be the best looking thing to look at, but their inner beauty shines throughout, which makes them beautiful. And that's why it's so important to always look with your heart and not with your eyes. And remember, there are people out there that have disorders that we can't see. Just because you can't see something does not mean that it does not exist, that it's not there. That's why we're not supposed to be judging one another. Because we can't walk a mile in their shoes. We don't know what they're going through. We don't know what their physical limitations are, what their mental limitations are, what their daily life is, what their struggles are. We have no clue. Just like that, nobody has a clue of what your struggles and limitations are, whether it's physically or mentally. Nobody can walk a mile in anybody's shoes. Now, we can't control what anybody else is thinking or what they're saying, but you can control your own thoughts, your own actions. And remember, every action has an adverse reaction. Now, it could be, they have good and bad consequences. It's up to you on how you have it. You say something bad or do something wrong, you're going to have bad consequences. You do or say something good, you're going to have good consequences. It's up to you how you make your life. But remember, it also affects you physically. And what I'm saying is, when you encourage, uplift, and inspire somebody, you're not just helping them out, you're helping yourself out, because that releases something inside your body called endorphins. And these endorphins help heal you both physically, mentally, spiritually, and emotionally. Now, when you do the opposite, you're going to get negative effects. You're going to feel sick, you're going to feel down, because your body, it's like a toxin. So what we say and what we do has a lot to do with our health, both mentally and physically. Just like what we put in our mouth has a lot to do with our health. If you're going to sit there and eat junk food all day and not eat anything nutritious, well, you're going to have health problems. If you balance that out and have nutritious meals with a few snacks throughout the day, well, then you shouldn't be having any health problems. Everything we do or say on this earth has consequences to it. Remember that. And we're not here to judge. So let me just remind you, I'm talking to you, I'm getting up and close and personal with you. Yes, you out there. Let me just say this to you. I love each and every one of you out there. You're all uniquely made. You're all created wonderfully. I may not agree with everything you say or do, but it's okay to disagree. Let's agree to disagree. It doesn't mean I care for you any less. I don't care if you don't come to my channel. You're a human being. You're an individual. You were made uniquely and wonderfully. And you're important to me. And your life matters to me. Everybody matters to me. Because that's the way we were meant to be. We can't be loners. That's what loneliness is about, is being alone. And nobody likes it. We were meant to have communication with each other. If we weren't meant to communicate, we wouldn't have a vocal box. Okay? The things we were given, our eyes, our ears, our senses, our vocal box, everything has a purpose on our body. Okay? The vocal box was not put there to put somebody down or to be mean in any shape, form, way, or matter. It was put there to communicate. And when we communicate in a good way, as I said, it helps heal you on the inside on whatever's wrong. So always think before you speak. And remember, nobody's better than anybody on this earth. I'm no better than you, and you're no better than me. We're all equal. And I love each and every one of you out there. So until we see each other again, remember that. I love you. Bye.